Hello, everyone, and welcome to the PCOS newsletter and podcast. Today with me, I have Olivia. Hi, Olivia.
Hello.
So Olivia is a health psychologist and a registered nutritionist, someone that I have dear to my heart when it comes to nutrition and psychology and behavior. And today we're going to talk about the equation that weight loss or weight equals health. And I'm super excited to get into the chat.
Yeah.
Olivia, would you like to introduce yourself?
Yes. Hi. Thanks, Francesca. It's great to be here. I'm so pleased that you're doing this. It's really valuable, a great resource for people. I'm really excited to be here. We used to work together years ago when we worked for an app that did focus on improving health through weight loss. But I've been through quite a journey since then, and I definitely would advocate for the fact that weight is not a proxy for health.
100%. And more kind of to go back into the PCOS world, I think women with PCOS are often told go and lose weight is one
Yeah.
of the first things, as I've heard it multiple times. But we also know that not all obese people have PCOS. Not all people with PCOS have weight. So I really want to detach this weight and health kind of equation apart with you today.
Yeah.
How do you think we got here, and what is problematic about it?
It's a big question, and it's something that I think a lot about and often. And I'm not a medical professional, so I'm a health psychologist. I'm a chartered health psychologist. I'm registered with HCPC. I'm a registered nutritionist, but I'm not a doctor. I'm not medical. I don't have that medical background. But some of the questions I always have for medical professionals who are presented, for example, with a late teens girl with PCOS who goes to the doctor for support, and I've heard of this anecdotally and quite recently, and they get told that we're not going to pursue any diagnostic with you until you've lost weight. We're not going to pursue any healthcare until you've lost weight. And I think, okay, so as if I put myself in the shoes of that person, of that teenage girl, what has she just heard from the GP? She has heard, I don't value your presentation. You have come here and you think you have all these symptoms and you are saying you think you have PCOS. I'm not sure I believe you yet. That's what she's hearing. She's also hearing that your body is too fat for healthcare. And she's also hearing that I'm not going to give you help yet. So go away and lose weight. There are real gaps there. For me, if it were my daughter or if it was anybody, what do we really want that teenage girl to understand? If I was a doctor, what would I really want that teenage girl to understand? Well, what is the mechanism that means that by having more fat cells, you are more likely to have PCOS? And what is the mechanism by, we're not going to reduce the fat cells at that point, are we? I mean, we might be in a teenage girl, but it's very unlikely that we're going to reduce the fat cells. We can reduce the number of fat cells. We might reduce what's in the fat cells, but we're not going to reduce the fat cells. That teenage girl really needs to understand why she's being told to lose weight. But does she? Is another question, because is there another way to address this? We know that if we send people away with PCOS or symptoms, or they're going to be fighting their hormone profile. So they probably already have an increased risk of insulin sensitivity. They're already fighting hormones that mean they're more likely to have adiposity around their middle. Why do they need to shrink their body in order to get healthcare, to reduce their symptoms? Is there something else they could focus on? And we know that there is. We know that we can conduct biological interventions without a focus on weight. We do not need to tell someone to go away and lose weight, particularly a teenage girl who is surrounded by social media, surrounded by a culture that tells her that thin is better, thin is successful, thin is more beautiful, thin is more healthy, all of these messages. And that is going to lead to potentially stigma, shame. None of this is going to mean that teenage girl goes away and loses weight. It's going to mean that teenage girl goes away and thinks, I'm not valued, I haven't been listened to, I've been told I'm fat and I'm a failure. I don't see how that is healthcare.
No, 100%. And I think this is true. Like I recently had a conversation with someone that said the same thing
Okay.
if she wanted to pursue kind of fertility,
Okay.
treatment. So we're not going to talk to you unless you lose weight, because otherwise, like we're not going to talk about your fertility. And there's so many problems there, because even, the moment you say weight loss, people think about body image.
Yeah.
People start like I'm not worthy. So like, is it because I'm big, I'm not worthy of medical attention? But also there's just so much to do with how I look when we talk about weight. So we're not talking about how you fit in your clothes. You don't feel, we're not talking about how you feel as a person. Do you feel healthy? Do you feel energized? Is your period coming? Like, we're not talking
Mm.
about the biology. We're
Yes.
actually talking about how you look and how big you are, which I think
Yes.
really honestly makes everything so complicated and confusing, and
Yeah.
it leaves us in kind of the hands of the diet culture. You mentioned there very briefly like biological interventions and biology. I kind of
Yeah.
want to kind of dig a bit deeper on like, what do you mean by that, and
Yeah.
how does that?
Well, so this really fascinates me, this area, because I mean, obviously, I'm a psychologist and I've been a behavioural scientist, and I love behavioural science because for me, behavioural science is so simplistic. It's human nature. It's basically why are we doing what we're doing. But when we think about health and anything to do with weight loss, we always pin it on behaviour. And what I think GLP-1s have done beautifully is they have reminded us really overtly that we can't fight biology. And for years, we have been asking behavior to do biology's job. So for me, firstly, I'm talking about weight loss here, but actually, I really wouldn't advocate for weight management, weight loss. I think I'm not saying that good work doesn't happen in those spaces. What I'm saying is the framing is wrong. Because if you frame something as weight management, why can't it just be health management? Why can't it just be health improvement? Why does it have to be weight management and weight loss? But anyway, so back to the biology. When we think about what GLP-1s are showing us, that actually, if you want if you want your body to change, so if you did want to lose weight, and if you told someone to lose weight and their fat cells did start to decrease, not in number but in size, what automatically happens then is we increase their hunger. So, they're automatically not going to be satisfied and their hormone profile is going to change. This is critical weight science. They're going to restrict and therefore they're going to change their metabolic thermogenesis. Again, I'm not medical. This is sort of through research and reading. But critical weight science, hormone profiles, if you put them on a medication, that supports those changes and they do lose weight. As soon as you take somebody off that medication, they're going to feel hungry again. Everything is going to change. And this is simple homeostasis. It's GCSE biology, and it's something that we've ignored. I'm not saying there isn't a place for behavioural science. What I'm saying is we've got to stop asking behaviour to do biology's job. And if we want behaviour to do biology's job, we need to be a lot smarter about what our behavioural interventions are. So in an example of PCOS or PCOS, for example, you might increase somebody's protein intake or their omega-3 intake, but you would do a proper blood profile. You would really want to understand what was happening for that specific individual, and you would want to sort of examine their sleep, their stress. If you stigmatize them because of the size of their body, you're spiking their cortisol and you're leading to, you're increasing their likelihood of gaining fat adiposity around the middle. So there's so much complexity here. And that's really why I'm fascinated by what's biology and what's behavioral science. And we need to be really careful about how we're positioning both.
I really love that. And my first thought when you say this is it's extremely hard to diagnose the biology of
Yes.
um, PCOS
Yes.
and weight gain, right? And I think this is where our systems are not really well positioned to understand. Wait a second, this person obviously looks a bit like they're carrying extra weight,
Mm.
right? Which could be all good. But how are they sleeping? How many jobs do they have? Was there access to quality of food? Um, and do they have a hormonal condition that is driving more insulin resistance, more testosterone, more hunger? Do they have an issue with their GLP-1, right? Like with their hunger hormone, with their leptin, with their. So I think breaking that down is potentially quite hard. I don't know if you
Yeah.
agree, but maybe
Yeah.
that's why we kind of go to the outcome almost.
Yes, I couldn't agree with you more. And so 'cause some of the things that come to mind with me, and I often ask medical professionals about this because, like, when I speak to GPs or physicians or anyone in the medical profession, they're really knowledgeable and they really know what they're talking about. And quite often that can be not a good thing because I will be told, no, if you have adiposity there, people have to lose weight, because if they have adiposity around their eye, it'll affect their eyesight. But they know things that I wouldn't know, as I'm not a medical professional. But what I always want to think about is this. If you have someone in front of you who has symptoms that could lead towards a diagnosis of PCOS, why are we not focusing on the symptoms? Why are we so worried about purely just about the fat cells? Why are we worried about weight? Really, what we should be thinking about is, okay, what are these symptoms? How can we support their health? If we wrap it in weight, we are causing problems and harm potentially. Not always. Like, there are examples of where weight loss does support an individual, it does work for people. And, we have to be really careful about that conversation with GLP-1s, because there are people losing a lot of weight and transforming their lives and feeling better. I would argue they're feeling better because for reasons beyond just health, although there probably is health too. But when it comes to PCOS specifically, as you say, it's so difficult to diagnose the biology, but we should be focusing on that. We should be focusing on the health issues, not the weight. Let's take weight out of the equation and let's focus on the symptoms. Let's try and improve the symptoms, not the weight.
Yeah. And one way I was thinking of comparing this is also, I hear like, let's take another symptom of PCOS, which obviously weight gain can be one, but acne,
Yes.
and I see this acne is also treated very superficially as well, right? Like a lot of people would go down the route of a dermatologist. I had a friend recently that went to her GP and she said, oh, it's just some clogged pores, but it was clearly showing up in places where we know it's hormonal.
Yeah.
And there was such a resistance to going and finding the biological kind of root cause of it. And I still see so many women with PCOS in forums, like really trying to treat acne or hair loss or all of the symptoms with superficial solutions like a cream, which is pretty much the same as treating any other condition with weight loss, right? Is actually the worst way to go about it. Unless if you understand why you're losing hair, why you've got acne, what are the hormones that are driving it, and actually really try to manipulate those underlying mechanisms, you will see that the acne will go down. But I think where it breaks is that there's too much complexity on the biology side.
Yeah.
Vs what you tell people, because that's another thing, right? If you go to the doctor and the GP in 10 minutes has to explain to you how your testosterone influences insulin resistance and fat cells, and how actually, making sure that we reduce the testosterone levels will then lead to, your period coming, like even me saying it now, it's complex.
Yes.
So I do think one of the reasons why we are simplifying these things so much is for maybe people to go away feeling like they've solved something and they have an answer. I don't know. What do you think about that?
Well, yeah, no, I agree. And actually, whilst you were talking, I was remembering what you had referenced in your previous question, which is about how easy it is to measure the outcome and a simple outcome. So again, this is sort of behavioral science, isn't it? And if you think about the COM-B model, which people may or may not know about, that is so well recognized because it makes it so simple to understand why behavior might or might not happen. Bearing in mind, it doesn't really include biology to the extent it should. But if we think about what people want, we want people to leave an appointment with, and what commissioners and GPs want to feel when their patients leave, we are under this constant pressure to, well, if you think about the organisation we used to work for, they would get commissioned based on their weight loss outcomes. It's so easy to base outcomes on BMI. It's so easy to sort of make everything really simplistic, but it's far too complicated to try and explain to someone their hormone profile, because actually we might confuse, it might not be valuable, it might in fact be harmful. But I do still think there is a way, there definitely is a way to remove weight from the equation. And when we are, the danger of diet culture and PCOS and weight gain is that if one of the symptoms of PCOS is weight gain, who cares? Like, what is that weight gain going to lead to? If that is going to lead to increased insulin sensitivity, let's treat that. Let's treat that. Should this person be going on metformin? Should this person be increasing their intake of omega-3? Should this person, and these are medical interventions, but rather than just focusing on the outcome that we want for our commissioners or for our targets, and the outcome that if a patient left our therapy room, my therapy room, or a GP's surgery, not feeling like they had to lose weight, but feeling like they had a productive way to support their health and reduce their PCOS symptoms that wasn't surrounded by restriction and a future of being hungry all the time and fighting their hormones, that would be a better outcome for me. But it might mean that the GP couldn't then report a reduction in BMI because that person might get healthier without losing weight. So that's, is that a risk for the GP? Well, who's that a risk for? Nobody.
Essentially, what we're kind of getting to is that we just do not have reliable ways to measure health
Yeah.
that is beyond very few things like weight, maybe cholesterol levels, but weight is kind of predominantly in all chronic condition is the way to, even in
Yeah.
cholesteremia, in diabetes, in hypertension and everything, weight is, because weight obviously is correlated to be a factor in
Mm.
making things worse, better, right? So then we try to manipulate that single thing, but then it just comes with all of this array. So actually the future will be to find better ways of measuring
Well,
health.
but I think we
Mhm.
do actually. Sorry to interrupt you, but I think we do have. So if you think about if you're diagnosed with type 2 diabetes, within your first year, you have to undergo sort of 8 or 9 checks, right? And if you think about what we're checking in type 2 diabetics, we're checking for kidney health, we're checking for urine, we're checking blood pressure, we're checking blood glucose. We do check weight and smoking status as well. We check eye health, foot checks. We have plenty of really easy health measures and an increasing amount of health tech. You can even check your blood pressure on on a phone screen. But there are ways to check health beyond BMI and weight. So especially for PCOS, like could we be monitoring blood sugar without without over monitoring, because we know that that can be problematic. But could we be monitoring different things, particularly blood glucose with CGMs? Like we do have ways to measure. It's just that we have such an entrenched model. Or if you look at all of our research, there's an amazing research network called WIN, WINN, and they are basically their whole purpose is to try and get people to do more research where they are measuring health outcomes, not weight outcomes. Because if you look at research into any health condition, CVD, hypertension, cancers, quite often one of the markers is weight. And the lead thing that people research or report on is weight. Why? Why aren't we reporting on blood glucose levels or blood pressure and it's easy to do. It's just that we seem to have a barrier to doing it because we're commissioning on weight metrics.
And it's cheaper, right? Realistically
Maybe,
speaking,
yeah.
it's much cheaper.
The
You
scale,
get
yeah.
on a you get on a scale and then it's there, compared to having to send a blood sample to the labs, which then includes
Yes.
getting the
Yeah.
samples. So I think there's also some health economics in there that actually,
Yeah.
this is the easy one.
Mm.
Blood pressure is probably also again the next cheapest one to kind of do.
Yeah.
In PCOS, there is quite a lot of research, and a lot of them um, do measure fasting insulin, fasting glucose,
Okay.
a lot of the testosterone profiles,
Yeah.
FSH, LH. So, but those are not accessible to the person sitting in front of
Yeah.
you, right? Like
Yeah.
I have not gotten, if I remember correctly, any blood tests from the NHS for my PCOS. I only got an ultrasound when I first got diagnosed, but beyond that, like there's nothing that then monitors me to see how my insulin's doing or how any of my hormones are doing. It's kind of like just there,
Uh,
So then you kind of let the consumer have to make those decisions, and it is complicated, right? Because now you're looking at your productive kind of, hormones. You're
yeah.
looking at your glucose profiles. You're looking at cholesterol, testosterone. So I think because of how complex this condition is specifically, it's pretty hard to find one.
Yeah.
But again, we did it for diabetes, so it's not impossible,
Well,
as you mentioned.
yeah, I mean, I don't think it is impossible, but I totally agree with you that I think this is a cost issue. But just to sort of offset that a little bit, I very rarely meet healthcare professionals or people working in healthcare who don't want better outcomes for the people they're serving or working for. Like it's just, when I talk, I quite often, I have to remind myself and be reflective that when I'm saying I just don't think weight management is the right framing, I really don't want to undermine the amazing work that is ongoing under some of these titles. It's just that the framing is so problematic because it means that without thinking about it, we are moving away from health being at the center of what we're doing. Weight becomes, we have a weight-centric health paradigm rather than a health-centric health paradigm. And I think that when you really sit down and have conversations with people, there are sort of two schools of thought. There's one school of thought, and this is very public health, which is that no, weight management is basically it's the golden bullet. It's the right thing to be doing. It will work, even though the uptake for it is so poor. But it's like, it will work, it will work. And of course, it's entrenched in that system because it's the way it works. But when you talk to people actually working in those diabetic nurses or nurses working away, anyone working in weight management clinics, they have a conflict when they get put in front of somebody who's in a fat body and they're telling them to lose weight, because they see the reaction. And it's like, why can't I sit in front of a person in a fat body and say, right, what is it about your health you'd like to improve? And let's focus on that. What is the barrier to that? And if it is just cost, that feels a shame, because actually I think weight management in the NHS is hugely expensive. And I don't think it's meeting targets. It might be now that GLP-1s are in, but no, exactly. So I still don't see the huge barriers other than cultural.
Yes, definitely culture. Yeah, for sure. And a bit of I think there's just been so much research that has correlated obesity with an increased risk of disease, right? And
Yeah,
I think that's where we're just hanging on to the manipulation of
yeah,
that rather than what is it that has driven the obesity problem,
yeah,
right? And how do we manipulate the things in there rather than the outcome? Because weight gain is an outcome of something, be that biology, behavior, environment, also like hormonal problems, etc., etc.
mm,
So rather than actually trying to manipulate the outcome, we need to actually go and figure
yeah,
out what's driving it. But I think it's because of, obviously, there is this very strong correlation that, of course, is not for every single disease. And there are people that are obese that are maybe healthier than people that are not, right? But
yeah,
overall, I think statistically, I think that's what's kind of driving this. We're all getting fatter. Like, let's just stop and
yeah.
it's,
But it's
um,
like we are,
it-
I think there is that. It is a correlation, but it's not always a causation. And for
yeah.
me, what's showing up a lot for me in the circles that I work in is sadly, because of GLP-1s and the focus on thin, and a real increased focus on size, and there was, there was a sort of a more compassionate approach even 2 years ago, where GPs were starting to be a bit more values based. I'm not trying to criticize GPs here, by the way, at all, but there was a sort of movement towards actually, yeah, let's be strong and let's have bigger bums and let's just embrace our bodies and let's not worry so much about weight. And it was slowly shifting, and then GLP-1s have come in, and there's an amplification of the noise, and there's more boldness. And, a personal example is that I've had a few healthcare appointments lately. I'm absolutely fine, but I've had a few healthcare appointments, and so has my 16-year-old daughter. And there hasn't been one appointment where there hasn't been reference to size. And actually, in the appointment that my daughter had, the doctor even said, well, because she sort of sometimes gets dizzy spells when she stands up too quickly, very common. The doctor said, well, that's because you're lovely and thin. And I thought, well, that's strange. So a very credible professional who, like, quite revered really, probably by teenagers, that's a career that maybe you would go into if you were societally and, credible, and has just told my daughter that because she's thin, she's lovely. She has just told her that her entire value is based on her size of her body. So you're lovely and thin. So that's a really insidious message to give her. And my other daughter, when she was 8, was a gymnast, and she was, you can imagine, she did 18 hours of gym a week. She was like very muscly, very lean, and she had a cough, and I took her to the doctor, and the doctor sort of listened to her chest and said to her, I wish all children your age had bodies like yours. And I remember thinking, so now you're telling an 8-year-old girl that really she needs to have a body like this, but she was doing 18 hours of physical activity a week, and it actually did more harm to her little body than good, because she's got back problems, so I just think
Your
this
hormones.
it's just so ingrained in our medical, in the way we describe bodies when we're talking about health. You're lovely and thin. Well, that's because you've got a beautifully thin neck, is what I got told when someone was like, what do you mean beautifully thin neck? I'm like, hang on, I'm just here to find
Do
out
you
if
have
that's
a
normal. I'm like, I don't, it's just, it's fascinating to me that people are more and more now than they ever have been talking about thinness and fatness.
Do you think it's down to the fact that we experience life visually? I'm thinking, right, like that's kind of, obviously we have loads of other senses, but if you think about our most dominant kind of sense, it is visual. So then, like, and then this kind of visual with culture, environment kind of creates so many associations in our brain. So then it's like see, and then you make the jump to, okay, what does that mean that I'm seeing? And then thin equals healthy, overweight equals unhealthy. And we're just kind of like keep repeating that into our own brain. Like what happens, like,
I know what I mean. For me, it's just a question of we are fat phobic, and that's a real shame because, as you quite rightly said, it doesn't matter what size you are, you could be healthy or unhealthy. And if you're in the healthcare professional, size should be irrelevant. Adiposity shouldn't for some conditions. Like, absolutely, if you've got high levels of adiposity around your vital organs, we need to work with you to try and improve your health. But let's work out how we can biologically sort that out rather than telling you to go away and go on a diet before I will give you healthcare. Like the inequity that is causing. And especially for me, I'm really concerned about PCOS, and particularly because you can increase your fat cells during your teenage years. And once you've increased your fat cells, you can't get rid of those fat cells. So even then, when you start to put that person on a diet later on in life and you're telling them to restrict as a way to improve their health, you're basically saying to them, go away, fight your hormones, be hungry. It won't work.
exactly.
It's unkind in its best form. We need to focus on, okay, what are your symptoms? Let's try and reduce those. And if you do that, you've got them. You're caring for them, not for their body, the size of their body.
And if you add on like how much of your reproductive system actually starts at that point, right? Like I have this very big kind of hypothesis about why I developed PCOS, obviously
Okay.
not scientific at all.
Yeah.
But when I was just starting to develop my reproductive system, I had incredibly bad nutrition. So
Okay.
my parents used to work in Italy, used to send crazy amounts of the best chocolate that you can imagine. I
Yeah.
remember the Ferrero and
Yeah.
world. And I do think I was under eating a lot of nutrients and overeating a lot of sugar. And I think that spikes in insulin and my body having to cope when it was so fragile into how I
Oh,
developed my follicles and my brain was kind of trying to communicate with the ovary.
yeah.
I really think that it really impacted just because I was overeating. And then as soon as I was getting to like 15, 16, then I was like, I felt like I was overweight. So then I started restricting and being more
Okay.
hungry. If you combine like a very immature reproductive system that happens in adolescence with on top of putting the body image and restriction and the
Yeah.
very bad nutrition habits plus the biology that could be also genetic, right? I don't know how much of the genetic element I have, is like you're creating this blend that this person will have to work 10 times 100 times harder later in life to kind of undo this very sensitive part of their
Yeah.
reproductive system.
And I think, I know that it's not, I know that it's your own hypothesis, but I'm a real believer that we know our own bodies. So if you have somebody sitting in front of you and they say, I know that I'm so sure this is why this happened, it should be listened to. Gut feelings are there for a reason. We develop our own narrative around our life. And as long as that's not a harmful narrative, they're very valuable if they're, that's the richest information you can get. And I look at teenagers now. So again, that's what worries me about people sitting in front of GPs in their teens and being told to lose weight, because it's like, well, no way. What are you doing? Like, okay, so they might gain some weight because they've got these symptoms, but still, please let's treat their health, because you're doing untold damage by setting them off on a cycle like you experienced, because it'll be, and critical weight
Yeah.
science shows us all we need to know about restrictive eating and the fact that will lead to a larger, fatter body overall and greater adiposity. It's just,
It doesn't work because you're
it
going
does.
against your biology. Yeah.
Exactly. Yeah.
I do wanted to touch on one thing
Yeah.
that I think you mentioned before, and I really want to kind of unpack it a bit. But you mentioned that, manipulating behavior is not
Mm.
necessarily a way of leading to better health outcomes.
Mm.
Um, What do you mean by that? Because in my mind is like, even with your biology in mind, it still kind of ends up with certain behaviors that might be conductive or non-conductive to your biology,
Yeah.
essentially.
Yeah, no, and I think that's a great question. And actually, what I mean is, I think that we rely too much on individual behaviour to solve problems. And I think placing the burden firmly on the individual can be problematic. So I love behavioural science and I think it has huge value. I mean, I've worked in a behavioural science unit in Wales and they do outstanding work. Like, honestly, some of the work they do is just, they're affecting real change, like really positive change. And it's just great to see. What I would say, and what they are actually really aware of, is when you place the burden on an individual to change a behaviour, unless you've got it spot on and you've got the support right, it can be risky for that individual. And particularly when you're talking about behaviours around health, it's all. So again, if I go back to the GLP-1 conversation, which is lots what everybody's talking about, what we have is we have people saying, oh, yes, of course. The reason that this hasn't been working is because it's biology. Of course, people can't lose weight because this is all about biology. And if we ask them to lose weight, then their body's going to gain it back again because it's biology. It's homeostasis. It's really simple. And it's almost a sense of relief. But that's strange to me because it's still framed in the wrong, it's still framed as weight loss and it should be health. We should be looking at GLP-1s and saying, so we're medicating for improved cardiovascular health, reduction in insulin sensitivity, whatever. But then the next conversation you'll hear is, okay, so when they come off GLP-1s, we need wraparound support, or we need wraparound support the whole time. So again, making the responsibility the individuals. Behavioural science, I think, really, really works. What I think we need to be careful of is that we don't overestimate the capability of behaviour. So when it comes to biology, what the organisation we worked for did really well was combine biological behavioural interventions, so sleep, stress, and they are so underestimated by people. People don't believe that if they've got a poor sleep profile, their cortisol is going to go up, and of course their health is going to decline. And yes, side note, that might mean their adiposity around the middle increases, but we're trying to shift away from weight. So I don't think you can't change behaviour or that you shouldn't. I think that actually works really well. What I think we have to be really wary of is trying to get to behaviour to do something that needs to be biologically informed, if that makes sense.
Yeah, I think the message I'm getting is that behavior can't override biology. And if you try to do it, it's not going to work. Because if you're naturally have an increased hunger because of a genetic condition that your leptin is up, and then you try to restrict or you try to eat because this is what the nutritionist told you to eat, at the specific time, and you're still going to be hungry at 4 p.m., you will be ravaging the cupboard because your biology or your insulin resistance or whoever you are, like, has not maybe gotten the nutrition that it needed, but also it just how your body works, right?
Yeah.
I think this is where what I'm hearing, if I put all of this conversation together, is that we kind of need to approach health and PCOS and all other conditions from what is the biology telling us for this person?
Yes.
Then what behavior can we put in place that support their biology?
Yes.
What nutrition we can put in to support their biology and behaviors, right?
Yeah.
And take weight out of the equation totally, and kind of try to measure all of this four things with health,
Yeah.
rather than health outcomes. Might be biological outcomes, or it might be how someone is feeling, or whether their blood glucose is going down, or whether their periods are coming back, or the symptoms.
Yeah.
Does that sum it up quite well?
That does sum it up. And I mean, the only thing I would add is that this is when we're talking specifically about biological mechanisms for health conditions like PCOS or diabetes or cardiovascular disease or hypertension, whatever we're talking about. That's when we're talking about a biological health condition. When we're talking about something psychological, we can, of course, use loads of behavior change and loads of behavioral science. There's CBT, there's ACT. But that is almost a different conversation. But it's not that behavioral science doesn't work. It's just that when it comes to biology and health and the physiological aspects of health, I think focusing on weight is the wrong thing to focus on. And trying to override biology with behavior can be tricky, but we can use behavior to support biology. It's just, I feel we need to reframe how we're doing that.
Yes, exactly. And yeah, I know we don't want to go on the rabbit hole around like the psychology of behavior and like and other it's like I remember us speaking to so many women, that just didn't believe that they can change their behaviors, right? So
Yeah.
that brings whole nother level of,
Well,
how
exactly.
do you might like you fix that, right? And like, and of course, if you've been told for like you've been alive for 50 years and 40 out of those 50 you've been told that you're big and you have
Mm.
no discipline, you have no understanding of how to eat well, and you're a fat person. I don't know how you're going to approach any of the biology, behavior, anything, because your mindset is like so has been attacked from so many levels, like
Yeah.
your nervous system. I just can't do it, like
No.
and I'm a failure and low self-esteem. And like it comes with so much. And you probably see that in practice all the time.
Well, yes, and that's why, and I mean, I think this whole discussion we've had has been fascinating, but there definitely is that element of, I mean, this is why I love behavioral science. You can change your behavior, and people can change their behavior, but we do need to give them the self-efficacy in order to do that. So exactly what you just said, if they've spent years being told they're fat and actually they can't change their behavior until they lose weight, weight isn't a behavior. So it's like, well, hang on, we're putting so much pressure and stigma and shame on that person before we can even get to the point of trying to encourage them to change behaviors, that we're creating barriers for change, for improved health right from the outset. But of course, behavior change is possible. I mean, look at atomic habits and all of those things. Of course, we can change our behaviors for to improve our health. I'm not sure we can. I'm not sure focusing on improved, like changing our weight, is ever going to serve us well. Trying to improve our health is always going to be better from a values-based perspective than trying to change our weight.
100%. With that in mind,
Uh,
Olivia, what would be kind of a closing thought for any person that is listening to this and sat in an office, and just got told to go away and try to figure out how to lose weight?
well, I mean, I would say to question that always. And I would always say if anyone is told to lose weight by a healthcare professional, that they should really ask, how can I treat my symptoms? And if the healthcare professional always goes back to weight, then I would either seek a second opinion or try and investigate it yourself, because really focusing on your health will have better outcomes. And I think by focusing on your weight, you're putting extra pressure on yourself. And we know from the research that focusing on weight doesn't necessarily work long term. But I would also say that don't put too much pressure on yourself to do anything in a certain way. There is absolutely always hope, and there will always be an approach that will work for you. It's just about finding that approach. But if you come out of an appointment not feeling like you found an approach that's going to work for you, or you're feeling bad about yourself, find another healthcare provider. Find someone else who could support you, because you deserve better.
I love that. I honestly love that. And I really hope that that part also becomes easier for you to be able to find the right professional to work with, which is a
Yeah,
whole
no,
another challenge. Thank you so
yeah.
much, Olivia, for today. This has been incredible.
It's been a pleasure. Thanks, Francesca. Thanks for asking me.